stage 2 colon cancer patients called coloprint, and that calculates the risk of recurrence as well. Low risk means a patient has about an 8% risk of relapse within 3 years and 11% risk of relapse within 5 years without chemo. A high risk means that a patient has a 20% risk of relapse within 3 years and a 22% risk of relapse within 5 years without chemo. Find out more about the Monoprint and the coloprint test at agendia.com. Now let's talk about scans. CT scans are typically used to detect new tumors and to monitor changes in tumor size. They can spot a lesion or a tumor, but they can't verify whether or not they're cancerous. What most patients don't know, including me in 2004, is that the radiation from a CT scan is 100 to 1,000 times stronger than a conventional X-ray, depending on what part of your body they're scanning. And that ionizing radiation used in CTs causes DNA damage and increases cancer risk. It's estimated that between 3 and 5% of cancers are caused by diagnostic radiation. Every CT scan you get increases your risk of future cancer, and the risk is much higher for babies, children, and young adults. So it's important to be cautious about your exposure to CT scans. There are other ways you can monitor your progress without subjecting yourself to potentially cancer-causing radiation. Another problem with CT scans is they can also result in overdiagnosis and overtreatment. A 2013 study published in JAMA found that lung cancer diagnosis rate was 11% higher with CT scans compared to X-rays, and that 1 in 5 lung tumors found on CT scans are growing so slowly that they're unlikely to cause a patient any problems at all. The study also reported that 320 patients have to get a CT scan to prevent 1 lung cancer death. That means for every 10 lives saved by a CT lung cancer screening, roughly 14 people will be diagnosed with a lung cancer that would have never caused them any harm. As many as 20% of lung cancer patients are suffering financially, emotionally, physically, and in some cases dying from the side effects of unnecessary treatment. Lung cancer is our #1 killer with a 5-year survival rate of about 17%. And remember, many 5-year survivors still have cancer. The small percentage of lung cancer patients that are quote-unquote cured may only be so because they were overdiagnosed and treated for a disease that was not life-threatening to begin with. In 2011, a team of doctors at Sloan Kettering published a study in the Journal of Clinical Oncology that examined the reliability of CT scans. They took 30 patients with stage 3 and 4 lung cancer and a tumor size of at least 1 centimeter and gave them a CT scan. 15 minutes later, the patients had another CT scan on the same scanner. On the second scan, some of the tumors shrunk by as much as 23%, and some tumors grew by as much as 31%. Again, this was after 15 minutes. Of course, the tumors didn't really grow or shrink. The study proved that CT scans can be unreliable when measuring cancer progression. And a tiny discrepancy in a CT scan can have massive consequences. If a CT scan shows that your tumor shrunk by 23%, you and your doctor might incorrectly assume that your treatment is working. If a CT scan showed that your tumor grew by 31%, you would assume the opposite, in which case your doctor would probably recommend more aggressive treatments, which may be completely unnecessary and harmful. The big takeaway here is that scans have a significant margin of error and can be misleading for measuring small tumor progression. A CT scan showing a 20 to 30% change in size may not mean anything at all. To give you some additional perspective, let's assume your tumor did grow by 30%. Although 30% sounds huge, in reality, this may only represent a change of a few millimeters. So don't let large percentages on tiny tumors freak you out. A 1 centimeter tumor that grew by 30% is still only 1.3 centimeters, which is tiny. Next up is the PET scan. PET scans are often used in combination with CT scans. The CT scan takes the picture, and The PET scan is used to indicate whether or not a spot may be cancerous with a radioactive glucose tracer that they inject into your body. Cancer cells uptake glucose faster, and the radioactive glucose concentrates in lesions and tumors that are cancerous and lights them up on a PET scan. But non-cancerous infections and areas of inflammation can also light up on a PET scan and make you think your cancer is spreading when it isn't. PET scan radiation is very high. You're getting radioactive glucose injected into your blood, and they're hitting you with a CT. So a typical PET scan can expose you to 1,000 times more radiation than a chest x-ray. Not something you want to get very often, if at all. And by the way, these scans are not mandatory. You don't have to get a scan just because your doctor wants you to. The scan is not going to help you get well. All the scan is going to do is tell them if your cancer is growing or shrinking, or if there's cancer in other parts of your body, but it could be wrong and lead to unnecessary treatment. Next is the MRI, which is magnetic resonance imaging. The MRI uses magnetic fields and radio waves, so there's no ionizing radiation. And compared to CT and PET scans, it's much safer. MRIs can spot lesions and tumors, but they can't verify whether or not they're cancerous. Now, some healthcare providers don't like to use the MRI because they're more expensive, so they require other diagnostic tests first. But MRIs are a much safer alternative to the CT and PET scan. And if you want an MRI instead, you may have to fight with your insurance company to get it paid for. Next is ultrasound. Ultrasound is a safe, non-invasive method that uses high-frequency sound waves instead of x-rays or radiation to produce images of your internal organs and babies in the womb. In some cases, tumor size and progression can be measured with ultrasound. It's totally safe and much cheaper than a CT, PET, or MRI. Thermography is also a safe, non-invasive screening method that uses infrared cameras that show temperature variations in the body, like in breast tissue. Hot spots on a thermography scan can indicate inflammation, a precancerous condition, or cancer. Now, thermography cannot diagnose cancer, but it can be useful to monitor changes in inflammation, which could mean changes in cancer. Thermography is growing in popularity as a safe alternative to mammograms. Just Google thermography and the name of your city to see if there's a practitioner in your area. Now let's talk about blood tests. There are several different cancer markers in your blood that your doctor can order for you. Elevated cancer markers typically indicate cancer progression, but there can be other causes of elevation leading to false positives. So always keep that in mind. Okay, here are the few of the most common cancer markers. First is the CEA. This is a broad spectrum tumor marker used to detect cancer activity in the body. A normal CEA is less than 3. The CA-125 is an ovarian cancer marker. Normal is between 1.9 and 16.3. The CA-15-3 is a breast cancer marker. Normal is between 7.5 and 53. It's a pretty big range. The CA-19-9 is used for colorectal, gastric, and pancreatic cancer. Normal for that is under 36. And then there's the PSA, prostate-specific antigen. That's a prostate cancer marker. Normal PSA is under 4. All of these can be ordered by your physician, and if you have insurance, your insurance should cover it. It should cost you very little out of pocket. If you're working with an integrative practitioner, ask them about a heavy metals test to see if you have high levels of toxic heavy metals like mercury, aluminum, lead, cadmium. Also ask about a micronutrient profile test like the SpectraCell test. This will show you if you have any vitamin or mineral deficiencies that need to be addressed. Next are some additional tests that can help you monitor your progress without a doctor. First is the Navarro urine test. This test measures the amount of HCG in your urine, which can be elevated if you have cancer. You can order this test yourself. You just collect a urine sample, mail it in, you get the results back in about 3 weeks. If your test result comes back under 50, that means you probably don't have cancer. If you're over 50, that means there may be some cancer in your body. The higher the number, the more likely you have cancer. The Navarro urine test is the cheapest, easiest way to monitor your progress. but it's only about 70% accurate because roughly 30% of cancers are not detectable by an HCG test. So if you get a Navarro urine test and it shows that there's no cancer, but you definitely have cancer, then obviously that's not a good monitoring test for you, but you've only wasted 55 bucks. You can order that through navarromedicalclinic.com. Another test is the Onco Blot test. This is a blood test that can detect 25 different types of cancer by measuring ENOX2, which is a protein shed by cancer cells into the blood. You can order this through your physician if they are familiar with it, and it may be covered by your insurance. If you can't get it through your doctor, you can order it over the phone from Cancer Center for Healing in California. It costs about $250 to $300, and they'll do a follow-up consultation with you to go over the test results. You can learn more about the Onco Blot at OncoBlotLabs.com. Another popular cancer marker test is the American Metabolic Laboratories CA Profile test. This is a combination of 7 tests, blood and urine, which makes it more reliable. There's an HCG urine test and an HCG blood test. It also includes the CEA and a PHI enzyme test. Elevated PHI enzyme can indicate cancer, but it can also be elevated if you have viral disease, heart disease, liver disease, or muscular disease. The CA profile also measures GGTP, which can indicate cancer-related problems with your liver, pancreas, heart, lung, and kidneys. The CA profile measures TSH, which is thyroid-stimulating hormone. If you're hypothyroid, that can be a precursor to cancer, but it can also be caused by chemo because chemo damages the thyroid. The last marker in the CA profile is DHEA, which is an anti-stress and immunity hormone, which is typically very low in cancer patients. If all of these markers are in abnormal ranges, then cancer is more likely. Now let me say something else. If you measure too soon, you might get a scary result. There's a phenomenon called tumor lysis, which is tumor die-off. So if what you're doing is working and your body starts breaking a tumor down really fast, it will release dead cancer cells into your bloodstream to be filtered out and eliminated, and cancer markers in your blood will spike. According to MedicineNet, both benign and malignant conditions can increase CEA levels. Chemotherapy and radiation therapy can cause a temporary rise in CEA due to the death of tumor cells and release of CEA into the bloodstream. Fluctuating levels of CEA during cancer treatment must always be correlated with other clinical findings. While worrisome, changes in CEA are not diagnostic of cancer progression on their own. So blood markers going up in the beginning may not mean you're getting worse. It may mean you're getting better. So that's why you don't want to jump to any conclusions if you get blood work in the first month after starting a hardcore healing protocol. I think it makes sense to wait at least 30 to 45 days after starting square one and then test again at the 60 or 90-day mark. I also think it makes sense to get blood work done through your doctor because it's the cheapest way to monitor your progress. I worked with an integrative oncologist, the late Dr. Roy Page, who supported what I was doing. Every month he ordered blood work, and we looked at various blood markers, including the CEA, to look for any changes. And about every 6 months for the first 2 years, he ordered a CT scan for me. Knowing what I know now, I would have had some of the blood tests I mentioned above instead of the CTs. I just didn't know about them. Now, depending on your type of cancer, there may not be a blood marker for you. If not, try the Navarro urine test or the Onco Blot or the American Metabolic Laboratories test for monitoring. An MRI, CT, or a PET scan will give you a picture of what's changed in your body. But the only way to know for sure if a spot is cancerous is with a biopsy. But they have risks as well. A 2004 study found that biopsies increase the risk of metastasis for breast cancer. Another study on pancreatic cancer did not find an increase in risk. So the jury is still out on this. It may depend on the type of cancer. Now let's talk about your testing mindset. My opinion is if there's a new lump or bump, you should treat it like cancer. And if you're trying to decide whether or not to do a CT or a PET scan at any point in the future, ask yourself, if this scan finds any more cancer, am I going to do anything differently? If your answer is no, the results of a scan are not going to make a difference in your strategy, then there may not be any point in the scan. Don't feel like you need to get scanned out of fear. You just need to get some kind of testing to make sure that you're on the right track. And you need to decide ahead of time what your next steps will be depending on the test result you get. You should hope for the best, but plan for the worst. Many patients only hope for the best, and then they go into a tailspin when they don't get good news. And then they make impulsive, irrational, fear-based decisions and get rushed into treatment they don't want to do. Don't let that be you. Think of yourself like Thomas Edison. Take an organized, methodical approach to your situation. You're conducting a healing experiment on your body, and you need to know if it's working. Edison tried 1,000 different light bulb filaments before he found the one that worked. Hopefully, you won't have to try 1,000 different therapies to get well, but you may have to make some changes along the way. Sometimes trial and error is involved, and that's totally okay. If you don't get the result you want, don't be discouraged, because depression and discouragement will steal your joy and suppress your immune system. Try to take a stoic approach to your situation. Just accept that it is what it is. Here are the results. Now, what am I going to do about it? It's really important to keep your perspective. You didn't get cancer overnight, and you aren't going to heal it overnight. It took a long time for you to get sick. It will take some time to get well. Be methodical, stick with one protocol, and monitor for at least 90 days. Don't change course until you're absolutely certain that what you're doing isn't working for you. Okay, that concludes Module 10 and the Square One coaching program. I've given you everything you need to get started to build your foundation for healing. Now it's up to you to take massive life-changing action. I firmly believe that what I've shared with you in Square One can have a dramatic impact on your life and your health, and I can't wait to share your healing story. Thank you so much for watching, and I'll see you soon.
In March of 2017, I was diagnosed with stage 3 rectal cancer. Immediately I knew that conventional therapy was not for me. I chose to change my diet and start Square One. And with a matter of just 2 weeks, I saw results. I had some scans done, and it already looked better. I still chose to have a surgery to remove my blockage because it was very painful. And now I'm 16 months later, and I've had scans done, the CT's come back clear, my colonoscopy's clear. I'm going to continue monitoring with my circulating tumor cell test, and if my wife makes me, you'll have an update.
Back in December 2016, I was given a cancer diagnosis. I was told that I had a rare and aggressive form of endometrial cancer. Now you're probably watching this because either you or loved ones are probably in the same position as I was then. And I really want you to know that you do have time, and please don't be scared. Take a minute now to relax and hear about my story. My decision was made easy. I was told that they could give me chemotherapy, brachytherapy, and forms of radiotherapy, and maybe even an operation to remove a lymph node that had grown to 13 centimetres and was proving to prove quite vital at the time. I was terrified. Probably the most scary thing actually was that I had an 11-year-old daughter who really I felt quite strongly I had to live for with nothing else. So when they told me that the treatment they had to offer wouldn't cure me, it may buy me more time, I was shocked. But if I were to be honest with myself, I wasn't completely shocked, because a few months previously I was very, very anemic through the blood loss. And I was lying in bed one day and I thought to myself, God, wouldn't it be great if, when I had the hysterectomy done and dusted, they discovered cancer? This would enable me to claim on some insurance money, which would set me free from my unhappy marriage and a business which, to be perfectly honest, even I'd won awards, my heart really wasn't into. Well, little did I know that it happened. Well, first of all, I believed that I really wanted to live and that I was going to live. I think that belief and desire to really, really want to live is critical to any choices you make coming forward. Whether it be the belief that you're not going to do chemo or the belief that you are going to do chemo, that belief is the key to any choices ahead. So I was still in shock, and because I had private medical insurance, I went straight through immediately within 2 weeks and started chemotherapy. It was really difficult for me. I did not do well. I was told I was very sensitive. I was sensitive because I literally could feel it killing me. I don't want to scare anybody here, but perhaps I felt like this because in my heart I knew it wasn't the right path for me. So after 2 sessions of chemo, each 3 weeks apart, I decided that's enough. I'm not doing this. I don't think I had faith that it would buy me much time, and I'm pretty glad that I stopped. It's not just the diet, which the Square One program is really critical for giving you great support in knowing how to completely change what you eat for the best. Even your mind, it clears your mind to really think more clearly. That was really critical. Spiritually, I had to really slow down and let go of a lot. So meditation, mindfulness, just having time by myself. Pretty soon I'd left the marital home and I'd moved into a flat which I called my sanctuary. I surrounded myself more with people that I knew loved me, that were building me up to feel good. All the negative, more toxic people I really did keep clear away from. And I look back now and I see that was a really good thing to do. So come September, and ever since September, it's now been a year since I've had clear scans, which my oncologist is obviously quite surprised by, because statistically I only had a 23% chance of reaching this Christmas. So come this Christmas, it's now August 2017, 2018, that's nearly 2 years. If I had done the chemotherapy and the radiotherapy, I only stood a 23% chance of being here for Christmas. I'm feeling great. As it happens, I'm here outside in the rain, actually, in Estonia, in Tallinn. I've taken my daughter to a wonderful conference for homeschooling, which I'm now focusing a lot of my time on. So again, my focus is on her rather than me. Life has really moved on. Cancer is a thing of the past. I'm not thinking about it every day. I know you guys, every minute will be consumed by the thought of cancer. I really have moved on, which is why I'm really convinced that come Christmas, I'm going to be cancer-free again. Well, no evidence of disease on the scans, and I have no intention of being otherwise. Yeah, that's me. May this bring you lots of hope and a clear vision that may be a way that you can work yourself forwards.